There are quite a few symptoms that a patient may have when they have acute kidney injury. A lot of the time they won't have any symptoms at all, and this is particularly common in the early part of their illness. But if you've got kidney injury or kidney failure, you may have a few symptoms like fatigue, or you may feel a bit nauseous. A lot of my patients develop swelling in their ankles and in their feet, and some may even notice a reduction in the urine amount that they produce. But generally, patients feel quite weak, and there are also a lot of other symptoms which they can present with, and a lot of it depends on the underlying problem that's causing the kidney failure. So there are various causes of acute kidney injury. I think an important thing to say is that certain types of patients are more at risk of getting acute kidney injury. And those type of patients are people who are elderly, who have underlying other medical problems, such as heart failure or diabetes, or problems with their circulation. More specifically, the patients with acute kidney injury can have conditions where their blood pressure is very low, or they are very, very dehydrated, and that can predispose to kidney damage. But some patients can also be on certain medications, such as antibiotics or pain medications, or some patients may have also received a contrast administered while they are ill in hospital for certain investigations. Those patients can also get acute kidney injury. And lastly, a lot of male patients that I see get prostate problems. And if the prostate causes a delay in the drainage of their bladder, they can have urine retention, and that can also lead to acute kidney injury. So there are lots and lots of causes, and the patients vary across the spectrum of the disease. So kidney failure can be diagnosed in various ways. Your doctor may be suspicious that you can have kidney failure based on your symptoms, but generally it's diagnosed by measuring your urine output, doing a blood test called a creatinine or glomerular filtration rate, and comparing that to your most recent results. And there are other more specific tests that we can do depending on how you've presented with your acute problem. And some tests may include a urine dipstick, where we look for blood and protein in the urine. And there are various other panels of blood tests that we can do and choose from. There are various stages of acute kidney injury. Over the years, the stages and the classification of acute kidney injury have changed. The most recent classification divides acute kidney injury into 3 stages, and these are based on the level of change in your blood test for creatinine or GFR, and also they take into consideration the amount of urine that you are making or failing to produce during your illness. Acute kidney injury can become very serious if it's left untreated. Patients with acute kidney injury can have significant health problems, and they may require quite intensive treatment. However, a lot of patients who have acute kidney injury, their condition can be reversible, and patients who are in general good health can recover quickly if they are treated early and their problem is identified very early on in the disease course. Acute kidney injury can be treated in various ways. To me, one of the most important factors is assessing a patient's hydration status and treating that, as the majority of patients are usually dehydrated and have a very low blood pressure at initial diagnosis of kidney failure. So hydration is key. Removing certain medications that the patient is taking can also be of use. Treating electrolyte problems and acid-base problems are also important. And a small proportion of patients we do need to treat with acute hemodialysis, where we place their bodies on a life or kidney support system where the blood is cleaned and the waste products are cleared.